Assalamualaikum. My name is Dr. Yasmin Kamaruddin. I'm one of the orthodontists here at Universiti Malaya. So my job is to straighten your teeth and improve your smile. Well, it all depends on what's the cause of your malocclusion. So for most of us, it tends to be the teeth that are a bit crooked, a bit crowded, they're in the wrong place. So the orthodontist comes in. Sometimes we take teeth out, sometimes we don't, and we straighten the teeth. But sometimes the problem is not just with the teeth, but the problem is also with the jaws. So meaning either your upper jaw or your lower jaw is too forward or too far backwards. If this is the case, then we can't solve your problem just with straightening the teeth. So we have to couple your treatment together with surgery. So we straighten the teeth, and then the surgery helps to correct the position of your jaws as well. So if your jaws are in the wrong place, so for example, your lower jaw is sticking out too much and the surgeon wants to push it back to improve the harmony of your face, the teeth might not be in the right position once they move the jaw. So therefore, that's why we need to couple orthodontics together with the jaw surgery as well. So as I mentioned earlier, the role of the orthodontist is to straighten teeth, to make the teeth look nice and pretty. But so typically, if you're doing braces together with surgery, you'd have a phase before surgery, about a year and a half to two, where we straighten the teeth based on where the jaws are at the moment. Okay, so it means that your teeth might look slightly worse just before surgery. Because remember, we're not straightening the teeth to make them look nice in the current position, but in the position that they will look after the surgery. But don't worry, okay? Because immediately after the surgery, once we move the jaws in the correct place, then the teeth will be in the correct place. So your smile will be improved. At this stage, you still have to wear your braces for another 6 to 9 months, just so we can sort of touch up your bite and make sure the top and lower teeth fit together nicely. And of course, just like any other orthodontic treatment, once we take the braces off, you'll need to wear your retainers. So retainers are lifelong. If you don't wear your retainers, then there's a good chance that your teeth might relapse, or in other words, move into the original positions.
Hello, my name is Dr. Kamil Hassan. I am an oral and maxillofacial surgeon. Orthodontic surgery is a type of surgery whereby the initial position of your jaws is corrected and is placed whereby the teeth meet better and equally. Orthodontic surgery is done under general anesthesia in a hospital. It is a type of surgery that is done inside the mouth, and all the cuts are done within the gum area. Therefore, no cuts or scars on the skin of the face. After the bones of the jaws are exposed, the jaw bones will be cut and they will be placed in the new planned position. And these new planned position of the jaws are then fixed with metal plates and screws. After the position of the jaws have been corrected, all the cuts in the gums will then be sutured with stitches and the surgery is finished. Like any other surgeries, major or minor, orthodontic surgery will produce a few outcomes, and these are quite common. They involve a bit of pain, swelling, bleeding, and infection. However, all of these common outcomes are then managed with necessary medications such as painkillers and antibiotics. Swelling is a normal reaction of the body towards surgical trauma, while infection is a rare occurrence and is more risky in people with immunodeficiencies. Normally, patients will be admitted to the ward one day before of the surgery, and this allows the patient to meet with the doctors and also the anesthetist. In the meantime, patients are also asked to be fasting from 12 midnight in order to prepare them for the surgery next day. On the second day is the day of the surgery. The patient will be pushed to the operating theatre and the surgical time will take around 4 to 5 hours. After surgery, patient will then be sent back to the ward, and on the next day, if there is no serious complications, the patient is allowed to go home. Usually, the recovery process takes about 6 weeks up until 3 months. For the first 2 weeks, patients will feel or will experience a lot of swelling, especially around the face and also the mouth. They can't chew any food, and they are only allowed to eat something that is very soft or liquid, such as porridge. The swelling of the face and also around the mouth will start to disappear after the first 2 weeks, and this can take up until 1 to 3 months to fully resolve. The numbness on the cheeks, the lips, and also the chin will last for a few weeks and up till a few months. Normally, patients will feel that the area of numbness will then reduce within this period.